Alright, welcome to part 2 of Charlie's Edition, The Joy of Gay Sex Theories. Tonight we're talking about STDs specifically, about the different types of STDs there are and what kind of symptoms go along with these STDs. If you have not seen part 1, I was actually talking about gonorrhea and bacterial STDs. Now I want to tell you guys what syphilis is. So, here we go. The first symptom of syphilis is a red sore called a chancre, about the size of a pea. Though this sore does not always appear, the skin breaks open to reveal the chancre, which may soon be covered by a yellow or a gray scab. It is painless and does not easily bleed, although it may be painful in the butt. Syphilis is highly contagious at this stage. Left untreated, the chancre heals by itself in a few weeks. Unfortunately, the disease continues to develop. This is the time to get to the doctor because while syphilis is less common than gonorrhea, it's more serious. The sore, if it appears, can show up as early as 10 days after sexual contact, but ordinarily occurs about 3 weeks after infection. Aside from it, there are no symptoms, except the lymph nodes often become tender, inflamed, and enlarged to the size of grapes. Secondary syphilis starts about 4 to 6 weeks after the initial infection. A rash, which does not necessarily itch, breaks out usually all over the body. It can even appear on the palms and soles of your feet. The patient has a general feeling of ill health, headaches, nausea, loss of appetite, and fever. Hair sometimes falls out. Luckily, it grows back. The person is highly contagious. He can transmit syphilis through all of the mucous membranes, including those of the mouth and anus. The second set of symptoms will also disappear within a few weeks, but then the illness enters a third, more dangerous stage. For several years, the untreated disease will be latent in the body. There will probably not be symptoms, though a sore may appear at the site of the original infection after a year or two. Once a year has passed, the patient is no longer infectious. Some advanced cases will move on to tertiary syphilis. There are 3 kinds. 1. Benign is characterized by the development of large lesions in and on the body. The second, which is cardiovascular syphilis, often ends in death from heart failure. The third kind, general paralysis, leads to the deterioration of the nervous system, or the central nervous system, and psychosis. This stage is usually reached 10 to 20 years after the initial infection. Fortunately, with the discovery of penicillin in 1943, there are few cases of tertiary syphilis. I can't read some words from here. Although syphilis can be cured easily if it's caught in its early stages, probably more than 50,000 gay men contract syphilis each year. A blood test for syphilis is usually negative during the first 4 or 5 weeks of the infection, but it then turns positive. Blood tests are not always reliable for early syphilis infection, so if you have disturbing symptoms, have a second test even if the results of the first were negative. The treatment for early syphilis is a large dose of penicillin, though other antibiotics are used for people allergic to this drug. And don't forget follow-up blood tests. The presence of the HIV usually complicates the treatment of syphilis. That's very interesting. So if you've been experiencing those symptoms, no comment, especially if you're very sexually active, you need to go get yourself checked. Alright, so let's talk about, now, a lot of these STDs and stuff that I'm reading are pretty much the major STDs that are out there. There's a lot of STDs that are out there, but I don't think they're all listed in this book, but a lot of the major ones are, so those are the ones I'm pretty much reading off to you guys. So, what are viral STDs? Unlike bacteria, a virus cannot reproduce by itself. It must invade a living cell to multiply. When a virus enters your body, generally through a break or pore opening into your skin, it moves in quickly. Your immune system creates T cells to attack it, but men with compromised immune systems may not be able to produce enough T cells to kill the virus. Therefore, AIDS patients may be either more susceptible to viral infections or to suffer more serious illness. And I'm just going to read a little bit of what hepatitis is, because there's a lot of different versions of hepatitis as well. So listen very carefully. This is very educational, because I'm actually learning about it as I read it as well. So, hepatitis. This serious liver disease is widespread in the gay community. It is communicated in many ways: by kissing, by contact with any of the mucous membranes, by eating infected shellfish, by rimming, by infected semen, introduced orally or anally, and through transfusions of infected blood. There are several types of hepatitis infections, now called type A, serum type B, and type C, which is similar to type B. Symptomatic, automatically they are all similar. Type B is the one that is spread sexually, but they are all highly contagious. If you have hepatitis, you must be careful not to infect other household members. No kissing of any kind. Keep separate dishes and wash them thoroughly. Since hepatitis is transmitted by feces, you should wash your hands after every bowel movement. The virus infects the liver. The symptoms resemble the flu: severe muscle aches and pains, fatigue, fever, nausea, and times vomiting. Sometimes a rash breaks out as well. Soon these symptoms disappear and you become extremely fatigued. Your urine turns mahogany brown and your shit becomes gray-white. Smokers lose their taste for cigarettes. Nausea and nearly complete loss of appetite occur. Then your eyeballs and skin turn yellow. This is called jaundice. By this time, the worst is over. Although you certainly won't look or feel your best. You may even have trouble getting out of bed. Hepatitis A is generally spread by feces that enter your mouth either through rimming someone or through food you eat, if a food preparer hasn't washed his hands properly after cramping. Shellfish can pick up the virus in contaminated water. Salads are a common transmitter if washed in contaminated water. The incubation period is 2 to 6 weeks, and during this time you are infectious. The disease runs its course by 2 months, and your liver generally recovers completely. But alcoholics whose liver may already be damaged may have a more difficult time with the disease. Cirrhosis may occur. Hepatitis types B and C are similar. Type B is often called the gay hepatitis because it is often contracted while tricking, particularly in gay men who are fond of rimming. The incubation period for types B and C is 3 weeks to 90 days. Hepatitis B and C can be lethal in HIV patients. Statistics also show that 90% of AIDS patients who contract hepatitis will become chronic sufferers. There is no cure for hepatitis, just supportive treatment. You must seek a doctor's care, and he will probably suggest plenty of rest, eating a bland diet rich in vitamins, and during the acute stage eliminating all fats, otherwise you'll become nauseated. He may also want to give you a shot of gamma globulin as a booster. Cut out liquor and recreational drugs for at least 6 months after you regain your health, or you'll have a relapse, which may be worse than the original disease. Don't make the mistake of thinking that you are cured of the disease when your eye color returns to normal. Take a multiple vitamin daily. In the past, complete bed rest was recommended during the acute stage, but evidence now suggests that moderate exercise is preferable. Discuss this with your physician first. Don't go to the gym without his permission. You will not be able to work for weeks, and during this period you will sleep more hours than you're awake. Only in exceptional severe cases is there reason to be hospitalized. Home care is normally adequate. Your lover, roommate, or friends will have to run errands for you. Don't be a hero, ask for help. There is now an effective vaccine for hepatitis A and B, but not per se. If you are sexually active, get the vaccination. Don't pull it off. You can get hepatitis more than once, and relapse is possible. It is a very serious disease. Dang, 10 minutes. So, very interesting, I must say myself. So far we've learned about the different types of hepatitis, we've learned about syphilis, and we've learned about gonorrhea. Some very terrible diseases. So, coming up on part 3 of Charlie's Edition, we are going to talk about what herpes are, warts, I can't say the word, venereal warts, and crabs. And even what the scabies thing is. So, I'm going to talk about those STDs coming up on part 3 of Charlie's Edition, The Joy of Gay Sex. Be right back.